from a arthritic standpoint or issues with the thumb CMC joint, I talked about on a video that it is one of the more common joints to deal with any type of changes. And it has this.
Good.
Okay. So what we have is a test that I use a lot in the clinic with called the CMC Grind Test. And I want to really work on showing you guys the positioning for this because it's really key if you're going to be able to fish out if there's any joint changes that are occurring between the trapezium and the first metacarpal. If you guys remember last September when I came in, I brought a prop with me, the Pringles potato chips. You guys remember that's the way that that trapezium really sits in this, it looks like a saddle joint. So when I do this, and in the literature it talks about being able to move that first metacarpal around in circles and stuff, but I will oftentimes be able to work that saddle in both directions, that I want to be able to make sure I don't miss anything, and being able to apply again enough pressure to know that I'm getting good compressive force on that joint. So if I have a patient that has come in and is subjectively describing that they're having a lot of pain right at the base of their thumb, they have a lot of pain and it hurts a lot to be able to try to pinch or grasp large objects, and it's just they can't do it. They feel like, one, they feel weak, and two, they will feel sharp pain with it. So I start to kind of look at this joint, and so what I want to be able to do with this test is be able to get in here to stabilize. Help me out.
Yeah, here.
Yeah, visually, yeah, just trust your guys' judgment
good.
on that. Is that I'm going to get in, I'm going to be able to really try to hold that trapezium and stabilize it. Okay, I do not want that moving, and so I will almost feel like a pretty good pinch, but I obviously don't want to cause a lot of pain symptoms for the patient. But I'm going to stabilize that that bone, that carpal bone, as I then grab onto the metacarpal. And I usually hold with four of my fingers, 3 fingers and the thumb. I hold all the way around the metacarpal. You can grab in whatever gives you the most comfort of stability when holding onto that metacarpal. But I will get in here and I will grind that first metacarpal on the trapezium. First, I'm going along the saddle where the trapezium is convex and the metacarpal is concave, so a little more on that radial ulnar direction, deviation direction, if I was to look at this. And then to go with a volar dorsal approach, where the first metacarpal is now convex and the trapezium is concave, is I'll get in there and rock that joint back and forth, both going volar and dorsal, where you're feeling quite a bit of pressure there.
There's a significant amount of compression.
You have to be able to get into that joint. You have to really stabilize that trapezium to get and put some good pressure in there to be able to make sure that you're grinding that joint to find out if there's any change in the cartilage or how irritated, how inflamed that joint is.